Bismillahirrahmanirrahim. My name is Ishtiyaq Hassan from GMM Group 10. Today we will discuss about anti-gout drug. Diagnosis. For a definitive diagnosis of gout, urate crystal must be demonstrated in synovial fluid on the thopus. Synovial fluid should be analyzed by polarized light microscopy. Once the definitive diagnosis has been made, the repeat attack do not require a diagnostic aspiration unless there is a suspicion of joint species. A normal or low serum urate does not exclude the diagnosis of the acute gout because the concentration may not be evaluated during an acute attack. Common side effect of uricosuric may include headache, dizziness, nausea, vomiting, loss of appetite, flushing, sudden warmth, redness, or tingly feeling, sore gums, urinating more than usual, itching, rash, hair loss. Sign and symptoms of gout. Any joint can be affected by gout, but it usually affects the joint toward the ends of the limb, such as the two ankle, knees, and finger. Sign and symptoms gout include severe pain in one or more joints, the joint following hot and every tender, swelling and the round affect joint red. uh, sh- uh, Skin is over the affected joint. Symptoms develop rapidly over a few hours and typically last 1 to 10 days. After this time, the pain should pass, the joint should return to the normal. Almost everyone with gout will experience further attack at same point, usually within a year. The primary uricosuric drugs, probenic benzrum or sulfenpyrazone. The mechanism of these drugs are inhibition of renal tubular transporter, thereby facilitating the excretion of the disease, causing the uric acid by blocking. Mechanism action of clonic treatment. The mechanism action of cloconine in the multimodal pathology of the acute inflammation associated with the gout. To consider the clinical utility of the colocilline in chronic inflammatory disease. Colocilline prevent the microtubule assembly, thereby disrupt inflammation activation, microtubule based inflammatory cell chemotaxis, generation of the leukotrienes and the cytokinases and the phagocytosis. Common side effect of colocilline include diarrhea, nausea, cramping, abdominal pain, and vomiting. Clonican tablet 0.6 mg, migrate capsule 0.6 milligram. Elimination of half life is 2.6 to 6 and 31 to 6 to 31 and 2 hours. Class of anti-gout drugs: xanthine oxidase inhibitors, allopurinol, febuxostat, uricosuric agent. The primary uricosuric drugs include probenicid, benzbromarone, and sulfenopyrazone. Secondary uricosuric drug with their primary use that have no uricosuric properties include losartan and atorvastatin and the fenofibrate. Thank you very much.